I know you've got a lot of back pain, and that's been troubling you for quite some time now. And you're thinking to go to your doctor and talk to them about this. Or it is that someone in your family has back pain and you are concerned about that. Now imagine you're sitting in your doctor's office and you're telling them about your back pain, and they start asking you questions one by one, and you start wondering, why are they asking about these? Have you ever wondered what goes inside the mind of your doctor when you are visiting them for back pain? Want to know more, as I will try to demystify and reveal the secrets of what goes inside the mind of a doctor. So this is going to be the first of many videos in a series in which we will try to simplify the interaction between a doctor and a patient and try to understand what goes inside the mind of that doctor. For those who don't know me, my name is Dr. Shoaib and I work as a nephrologist and internal medicine doctor at Cambridge University Hospitals. Before we start to demystify everything, I would like to request you to please subscribe to this channel and also press that bell icon, as it will help me make more of these videos for you. So the first video in this series is going to be focused on back pain, as it's a pretty common symptom and patients ranging from all ages do tend to get it on and off. Back pain can be caused by benign conditions and as benign as musculoskeletal pain, but it can also be caused by several sinister conditions like cancer for that matter, sometimes blood cancer or sometimes associated with bone. So it becomes that much more important for a patient to understand the importance of the questions that they will be asked once they visit their doctors, and also to have an idea of what might be going. And it goes without saying that the information presented in this video can only act as a guide. And if you're really concerned about your back pain after watching this video, you should definitely go and see your doctor. So they usually start by asking, how was the onset of the back pain that you have? And what they mean is usually trying to ascertain whether it was an acute onset, which is basically starting all of a sudden, or it was a progressive onset, like slowly building up over time. So what does it mean if they want to know about the onset? So if you say that you had acute onset, which is basically it started all of a sudden, and we're talking about only in the last few days or maybe in the last few weeks, but the start was a sudden start, then it makes us start thinking about the mechanical causes. Like if someone has had a fall and they've hit their backs, that could be one of the types of acute onset back pain. So the next question after this will be about the trigger. So they will start by asking whether you had a fall or were you lifting something heavy when you had this sudden onset back pain come in. So if you tell them about a trigger, it's pretty simple. They've got the cause and they will start treating that. But if you don't have a trigger, an obvious one, then that basically makes them think about something else. And by that, in this case, I mean a vascular process. So sometimes patient might have vascular clot or sometimes bleed. That could actually cause some kind of an acute onset back pain, but without an obvious trigger. Now imagine you answered that your back pain started progressively. That's slowly over a period of time. So what does that mean? So starting over a period of weeks to months can point to sinister conditions sometimes, like malignancy or metastasis, which is basically deposits of cancer in the bone tissue. But that's not always the case, because sometimes this can also happen in patients who are suffering from osteoporosis or osteoarthritis based on the age of the patient. So it's not always a bad news. Usually the next set of questions that doctors ask is regarding what makes the pain worse and what makes the pain better. Now, if your answer is coughing makes the pain worse, then this could be a feature of herniated discs. Now, in herniation, the discs usually lose their true position and basically they are displaced. It can happen because of a mechanical cause like fall or trauma to the back, or it can be related with osteoporosis and osteoarthritis. But regardless of the cause, if that's the case, then usually the pain is aggravated if the patient is coughing or moving about. Any physical motion will sometimes aggravate the pain. Now, what they might also ask is what makes the pain better. So if you answer that bending down, or flexion as we call it, makes the pain better, then we might be dealing with something called as spinal stenosis. So as you can see in this picture, on the left side we've got the normal spinal cord going through the spinal canal. And on the right side, you can see that the nerves which are coming out of the spinal cord on each side, right and left, the space basically which should ideally be as open as you can see on the left side, it's not as open, and there are tissue, basically bone tissue in this case, which is compressing this canal. And compression basically not only makes it difficult for the nerve conduction, but it also transmits pain and causes pain, which can sometimes be referred down the spine and downwards into the body as well. And that point takes us to the next question. So they might ask, where is the location of the pain exactly? And what they want to know is the exact point on your back where you're actually feeling the pain. And the next question is also about the radiation of the pain. So they might ask, where about the pain actually radiates to? Does it go down, and by down they mean towards the legs and then towards the knee and even below that? Or the pain stays around the chest side, or it's more towards the back of your body rather than being in front? If your answer is that your pain radiates downwards, downwards towards your legs and then even sometimes below the knees, then what we might be dealing with is called radicular pain. And this is basically exactly because of the reasons that I've already explained. Sometimes because of the spinal canal stenosis, there is a very narrow space that the nerves have to move out from, and that can actually cause pain. But that pain usually doesn't stay at one point. It basically radiates downwards into the spinal canal and downwards towards the legs and sometimes below knee as well. There are some kinds of pains which usually remain in the chest and in the abdominal region, and they usually don't radiate downwards into the spine. And one of those types of pains is the pain because of a heart attack. But it doesn't always mean that this is the cause, but it could be one of the causes. If your pain usually stays in the chest region, sometimes the pain can go and radiate towards the back, or it can actually radiate upwards towards the jaw or into the left arm, but usually stays around the chest region rather than going down into the spine. And it's usually towards the front of the chest rather than being towards the back as well. Alternatively, if your pain usually limits itself to the abdominal region, and more specifically towards the back of the abdominal region, then we might be dealing with a kidney associated or visceral pain, where most of the organs are below what we call peritoneum, which is basically an inner lining or inner covering inside your abdomen. And one of the organs that basically live there are kidneys. And kidneys usually, if they are infected, inflamed or swollen, sometimes can cause pain in the back, and it's usually towards the sides of the back rather than being in the center of someone's. A test that your doctor might actually do to ascertain whether the pain is because of kidneys or not is renal punch or lumbar region punch, which is basically simply tapping the back of a patient, and usually on the sides of the back rather than the center, and just basically checking if they've got any tenderness when they are being tapped. Your doctor now would ask you about associated symptoms along with the back pain. Your doctor might ask you if you have got temperature or fever. So if you have fever or temperature, then you might be running an infection. And a type of infection that can actually cause back pain is called septic arthritis, which is the inflammation and infection of someone's spinal bones. They might also ask if you're taking any anticoagulants, which are blood thinning medications. And that usually indicates to the doctor that there might be a complication and sometimes bleed into the tissues surrounding the spinal cord or within the spinal cord, which is again a rare condition. It's not a common thing, but that can happen and that can cause back pain. Another thing that your doctor might ask you is whether you've got hematuria or blood in your urine, and that can be a feature in patients who've got kidney stones. Usually, someone should not be getting a kidney stone with back pain unless they've got a malignancy. Or cancer for that matter, and conditions such as multiple myeloma can cause high calcium levels in someone's blood, which basically end up causing them to form stones. Now, blood in someone's urine can be because of other reasons as well, but this is one of the things to keep in mind. Obviously, your doctor will have the final say, and he will or she will conduct some tests to finally verify whether this is because of these causes or not. So apart from these symptoms or conditions, they might also ask you about IV drug abuse or family history for that matter, as in some autoimmune conditions which run in the family, patients do tend to get back pain as well. The next step will be physical examination, and they might end up taking temperature, which could be a feature in infection as I mentioned before, blood pressure, as pain sometimes can increase someone's blood pressure. And they would also look at your back and do a spinal examination. Well, they will be checking for any tenderness or pain in your spine. They might also do neurological examination or an abdominal examination. And they might end up doing something called as a straight leg raising test as well. And the idea is to see how much a person can actually raise their legs without actually inducing any pain. And even on a smaller distance or a smaller angle of rising, if someone gets back pain, and especially a shooting back pain throughout the spine, then that actually tells us that something is wrong with the spine of the patient. Next stage will be doing investigations. So they might end up doing some blood tests, looking for infective conditions, or looking at electrolytes, specifically trying to see what's the level of calcium in your body, which is again trying to rule out conditions like myeloma. But at the same time, they might actually end up doing MRI of your spine. Now that's basically trying to see the spine visually and trying to identify if there is any problem in terms of a spinal stenosis or a fracture or dislocated spinal disc. So all of those things can be seen on an MRI scan. Now that's how your doctor tries to reach to a diagnosis. Now I might have missed a few other conditions that might happen in a patient who has back pain. But usually this is how the doctors approach if someone has got back pain. And you should expect these questions and this kind of, line of thinking when you're visiting your doctor for your back pain. The final step is to find a treatment, but that cannot start until or unless we exactly know what's wrong with you. So until then, your doctor might end up giving you some painkillers. And ideally they would try to avoid some strong painkillers in the beginning, and they will try to start with something like paracetamol. And the idea is to try to protect you. Some drugs sometimes can cause problems with your kidneys if they are given in larger amounts. But again, your doctor does not want you to be in pain. So if you have pain, try to ask for something more or something different, and they can easily give you something else if the initial management is not working. There you go. So this is what your doctor was thinking when they were seeing you for back pain. If you like this video and you'd like to see more of these videos about different symptoms and conditions, please subscribe to the channel and press that bell icon so that you're the first person to know about a video such as this one. I will see you again with another one of these videos. Until then, take care of yourself and everyone around you. Allah Hafiz.